So, ladies and gentlemen, and distinguished guests, and fellow global health enthusiasts, a very welcome to all of you to this event titled Post-Pandemic Pioneers, WHO Intern Board Alumni Share Their Stories. I'm honored to be here before you as the host and the moderator for this insightful webinar. In today's fast-paced and ever-changing world, the World Health Organization's internship program has been a driving force in global health. It is an institution that has played an integral role in shaping the future of healthcare, especially in the wake of the unprecedented challenges posed by the recent COVID-19 pandemic. In this light, today we bring together a diverse group of former WHO interns who have not only experienced the WHO internship program firsthand, but also played pivotal roles on the WHO intern board. These individuals, they have a wealth of knowledge and experience from the internship and also have a lot of passion for global health. So throughout this next 90 minutes, we will have the opportunity to hear their stories, their WHO experiences, their insights, and we will candidly discuss the challenges they faced, the skills they honed, and also the impact they were able to make during their internship. Before we delve into this discussion today, I would like to emphasize on crucial point. The experiences and opinions shared today are solely those of our alumni. They do not represent the official views of the World Health Organization. This is solely a alumni-led event, and the perspective you hear today reflect the individual journeys and achievements of our panelists today. And also very important, if you have any question, then please type your question in the question and answer box that you will see at the bottom of your Zoom platform, and not the chat option. Of course, you can use the chat option if you want to discuss something, but for questions, I would recommend you put it in the question and answer box. I encourage all the participants to engage actively, ask questions, and yeah, embrace the spirit of learning. So let's begin, and thanks all for joining. And without further ado, let's turn to our panelists. I think we can, in the beginning, start with a presentation from Wendy. I will take this up. I will give the opportunity to Wendy to introduce herself and then give a short presentation about her experiences.
Hey, thank you, Rajon. Hi, everyone. My name is Huang, and then you can refer me as Wendy, and then I'm a former intern at WHO, and I will start the webinar with a short presentation of my experience of the WHO program, and then I'm just going to share my screen right now. Okay, I hope, can everyone see my screen?
Yeah, it's visible.
Okay, so I'll give me a short overview of the criteria, the application process, some of the onboarding things, and then because we will have a more in-depth discussion or session of our experience, so I won't go into like the things during our internship, but I will focus kind of on the process and the end of internship. And then so first I'm going to talk about some important. The purpose and objectives of the internship program is to provide a framework for assigning eligible candidates from diverse academic backgrounds to WHO programs where their educational experience can be enhanced through practical assignments and capacity building opportunities, and to expose students to the work of WHO. And also the WHO wants to kind of hear from us, from you. So it's to provide WHO programs with input from students specializing in various fields related to technical and administrative programs of WHO. And this is the purpose and objectives of the program. And to summarize, it's a very great learning experience for us. And it's also a good opportunity for the organization to see our thoughts and ideas. And moving on to some important information before you consider applying for a position is that the duration is with a minimum of 6 weeks to a maximum of 24 weeks, which is roughly 6 months. And then the eligibility criteria is that when you apply, you must be at least 20 years of age. And then you are in a university, or if you have graduated, you have applied to the position no later than 6 months after graduation. For my case, I was graduated after I applied. And the next one is that if you are not still doing your degree, you have completed the equivalent of 3 years of full-time studies at your institution, and then you are not related to a staff member. So example, your parents or your siblings do not work in the organization, and then you have not previously done an internship at WHO. And so this means that you can only do one internship. And then the last is you hold a valid passport of a WHO member state. And then so if you meet all of these criteria, then congratulations, you can start applying, look through the positions. And then so the application process is that you go to the application platform, which is called Stellus, and I have put a screenshot of the system right here. You just simply can Google WHO internship program. You click on the first link, and then it will take you to the official application platform. And then once you go to the website, we really encourage you to register an account and then set an alert. So when in any internship opportunities they pop up, you will be able to know it first at an early time, and then see if this interests you. And then the next thing is that in my case, I applied to several positions, and so I really encourage that if you are really interested, you apply and apply and apply. And then the process, the waiting process of getting in an interview email can really vary. In my case, I applied at the end of 2022, and then my team contacted me in April of 2023, and then so this time can take a bit long, and it kind of varies depending on the team or the position. And then once you receive the interview email, you go through the process, and then depending on the position, some teams, they might require you to do a written test based on some of the experience of my fellow former interns. And then the interview process, depending on the team, you might go through 1 round or 2 rounds. In my case, I went through 1 round. And then if they are if the interview went well, they will send you a link to complete a declaration of interest, and then you need to provide them with 2 referees. And once this process went through, you will receive a preliminary offer, and that at this point you can give yourself a pat on the back. You have started your journey at WHO. And then moving on. And so after you receive your preliminary offer, you will receive a link to upload some requested documents onto Stellus. It was a pretty much of a list of the documents, but they're like not difficult to complete. And then if all the documents are checked at HR and they are approved, you will receive and accept. You receive the official letter of offer, and then you accept it. And then for my case, I need to apply for a visa to enter at Switzerland, because the headquarters of WHO was at Geneva. And then before you go there, you kind of need to like find a place to stay, because we kind of need to find the place on our own. Like the organization does not provide accommodation for you, and then this can be a pretty big headache, because housing in Geneva can be pretty difficult. But and well, luckily, it finally got resolved. And then once you're all set with your visas and stuff, let's go to WHO then. Well, if in my case, because my nationality is Chinese and it's from a lower middle income country, and then so my flight was covered by the organization. That was my case during my internship. And then so which is pretty nice. And then when you have arrived, well, you report to duty on your first day, and then you will meet with our HR focal points to talk about the some of the formalities. For example, you're registering yourself with the Swiss social insurance system or taxes, and also applying for your like a card to proving that you work here, and then for staying and then settling, that kind of stuff. And then because we will be sharing more our experience at WHO later on, and so I will skip and then skip this part and then jump right into after you have finished. And then so when you are near your end of your internship, you can do a final presentation. It's not mandatory, but I strongly recommend you to do it based on my experience and then the experience of my other forum intern fellows. It's a good opportunity to kind of recap your learning journey, what you have contributed to the team. And then the next thing is we need to complete an intern evaluation form with your supervisor, and then you complete your exit survey. And then before you leave, you need to announce your departure with the Swiss insurance system and income tax, and then there are some other formalities to do, but these are the important ones that I have listed. And then the last two things that I recommend you do is that say a big thank you and then goodbye to your colleagues, your fellow interns, and all your friends. And then, of course, take lots of photos around the WHO building. And then that's my presentation about the WHO internship program. If you have any questions, feel free to type in the chat box. And then if any of the other panelists have anything to add on, please share your and please add your inputs. Thank you.
Thank you very much, Wendy. Thanks for your nice presentation. For the audience, Wendy was in World Health Organization Intern Board 2023 as a communications coordinator. And yeah, that was a very insightful presentation. And if in the audience, someone would like to have this presentation, I think our organizer, Collins, can later send it to all the registered participants via email. So don't worry about it. So I think you can get it via email. And also, most probably, we're going to upload this video on the YouTube channel of Erasmus Mundus Association. So me and Collins are also part of the management board of Erasmus Mundus Students and Alumni Association. So this would be completely online, CCBY 4.0. That means you can see, share with people, no problem. Get as many people to apply for this wonderful internship program. So that being said, we will move to Andrea from Fair Internship Initiative to share his experience. And what is this Fair Internship Initiative and why it is relevant? I think I'll give the floor to Andrea.
Thank you very much. Can everyone hear me well? Very good. Well, nice to meet you all. It's the first time I met, I think, most of you, so it's really nice. It's really exciting to be here. I am definitely sneaking into this event in a way because I'm not a WHO intern. No, I ever was. I actually am interning at the moment with the International Labour Organization, which is like across the street in Geneva. And obviously we all kind of belong to like the UN system, and we all fight for similar sort of things. So it's very exciting for me to meet other people and people that have been through the internship program, and also to talk to people that are interested in an internship with the World Health Organization, but more broadly, internship in the UN system. So yes, that's essentially what I'm here to talk about. I'm here to talk about sort of, I think Wendy did a wonderful job at kind of giving you a sense of the WHO internship process. I'd like to zoom out a little bit more and talk about what it means to be an intern, what are the challenges. I'm sure you hear very hopeful and constructive, positive things coming from the panel afterwards, but I think it's also very important to recognize that an internship is a wonderful time for personal growth and professional development, but it's also a challenging time for some people, and that is really mediated by, you know, one's socioeconomic status, where they come from. I was really struck by something Wendy mentioned about WHO covering flights for example, people that come from countries that are classified as lower middle income, which I think is wonderful, and that's like an example of how an internship can be shaped by, you know, the organizational decision that have been made for that to be a possibility. So that's kind of what I wanted to get into. I have a presentation that I prepared. Let me know if you can see it. I'm attempting to share my screen. We should be good. Thank you so much. Oops, spoilers. There we go. All right, so essentially this is what I'm going to talk about. I'm going to sort of outline a little bit what it means to be an intern broadly in the UN system and the challenges that a lot of people have facing, but also focus also on how you can get involved and you can ensure that your internship experience, and especially the internship experience of future interns, the cohorts of interns that come after you, is increasingly better, more accessible for everyone. So once again, my name is Moreschi, as you can see on the screen, and you can sort of contact me at any point. You'll have all the contact details at the end of the presentation. Thank you, everyone. All right, so this is the data that we managed to gather for the 2023 Global Intern Survey, and I really want to give you a sense of, first of all, you can see, I think this is very exciting to see, you can see that people really come from a wide range of countries. It's 116 in our survey. It's more obviously in the internship program, but these are people that are engaging with us. They are sharing their experience with us. So, you know, it's very, very important for us to hear from people across the world. And all these people working across 88 duty stations, UN duty stations, across 49 UN bodies. So this is kind of like a snapshot of people involved with the FII, or people that are engaging, you know, interns that are currently engaging with us. When we talk about, obviously, internships, a big important question is about whether one can even afford an internship. You know, internships, as we said, are like wonderful opportunities to, you know, for professional and personal growth, and they also often are the gateway to a UN career, and or another type of career that kind of aligns with what you want, with your vision for yourself. But, you know, they can be very expensive, especially if they're not paid. And this is probably one of the central sort of issues of discussion for the FII. And I guess it's on everyone's mind. This, as you can see, it's slightly disheartening to see. It's only 19%, so less than 1 out of 5 people are properly paid, as defined according to sort of the sort of minimum threshold for subsistence, while the overwhelming majority of people are either underpaid or unpaid, which obviously makes it really, really difficult for a lot of people to, you know, not only have internship experience, but have one that's fulfilling and that's, you know, feels safe and feels sort of fair and, you know, safe. I think safe is an important, like, you know, important feeling, because it really shapes the kind of experience that you might have. A WHO, I believe, has, for example, stipend. They have some benefits, but what I really want to stress is that's not the case for all agencies. And I'm assuming that, I mean, you're interested in WHO, obviously, but you might be interested in other agencies. And there are disparities across agencies that cause these kind of issues. Something that I personally find very, very worrying, and something that it's really like a reason for which I joined the FII and I'm kind of engaged in this kind of advocacy, is then when you break down the data by region, you can see clearly that the way the internships are set up, sometimes, actually quite often, they tend to reproduce inequalities that then end up sort of making up the structure of the UN as a whole. So as you can see here, Sub-Saharan Africa, which is a region that sadly is underrepresented within UN institution and UN staff, is the most likely people that come from there, interns that join from there, are the most likely not to receive any stipend at all, and when they do, is on average much lower as a percentage of DSA than other interns from other regions. So this is a way in which like a issue like pay then sort of trickles down and has a ripples effect into UN staffing. And as we said, like, once an internship opportunity is a great opportunity to then access the UN system and build up a career. But if you can't afford it, then you have staff that reflects those inequalities at the internship level. So this is really, really important. It's about making sure that internships are as accessible, as fair as possible for people across the world. It's very easy to be in Geneva if you live. My family is from 4 hours away from Geneva, right? Like, I took a train and I was here. That's a very low cost, but it's a very unique and privileged experience that a lot of people around the world don't share. And I believe that a UN system that really serves people across the world is a UN system that's made up from people, of people that come from countries across the world. So this is really, really important. As one respondent from the survey said, UN internships that do not offer fair stipend, that do not offer fair conditions, that are not financially accessible, do strengthen inequalities and sort of gatekeep opportunities from people, which is it's something that's very, very sad and something that's very, very unjust. But I mean, now that it's not all doom and gloom, I think it's very, very important to be sort of proactive and to make sure that I feel very lucky that I have a little place in the system, and I feel like for people participants attending this event, it's very, very important to be conscious of the change that you can make, which is why the Fair Internship Initiative for me is a great network of people that fight in order to ensure that current interns are having a good experience. They're accessing all those professional development opportunities that we all want. They're accessing all those transitional into a career, that they're accessing skill building experiences, and they're getting fairly remunerated. But also for future interns that are not sure if they can afford it, raising the bar really helps people, bringing in people. So this is the kind of fundamental mandate of the FII that then gets declinated around the world depending on the needs of the local duty station. And this was born in 2015, so it's been sort of operational for 9 years, roughly, going on to 10 soon. That's exciting. And it's an advocacy platform, so advocating for change, but also it is a network of people that are going through similar things. It's a great place to meet people that have similar concerns, that have similar experiences, or different ones, and sort of getting to know each other in that way. I have covered this already, but once again, sort of as you can see it, improving the quality of internships is super important, and that does not only mean pay. That means workshops, training, access to trainings, access to having access to HR services, and a good relationship with your supervisor, for example, is something that I'm sure will come up in the panel as being central to having a good experience. So all these things are very, very important, and also to make sure that once these quality internships are also are also accessible to people regardless of their socioeconomic status and their national origin. So yes, these are the two sort of overriding goals, and the way we do it is through a sort of variety of different means. Public outreach being a very important one. So making sure that the sort of discussion around internships and fair pay is an item on the agenda, but also around gathering evidence. So hearing from interns and future interns, current students, like, what are your concerns? What are you thinking about? What is maybe like something that would stop you or hold you back from doing an internship, from enjoying your internship? These are very important things. So we do sort of frequent surveys, which is, for example, the data you've seen right at the beginning of my presentation comes from one of them. And then we use that evidence to then advocate. We advocate, vis-a-vis obviously the UN staff and HR. That's very, very important. But also we kind of try to network and to, connect with other youth organizations, other young professional organizations, in order to also increase, your exposure to people, to experts, to former interns like the ones on the panel now. So these are all sort of ways in which we can strengthen our network as interns and former interns. And then obviously, sort of supporting internal organization as well within agencies. So for example, a lot of people I believe on the panel are former members of the Intern Board, which is a great way of kind of organizing, obviously, like professional development within organization, but also social events and making sure that we're getting the best out of the internship experience. So the Intern Boards are really, really important. Okay, in terms of what we've achieved so far, this is sort of as long as FII has existed. 7 UN organizations have started paying interns. That's huge. That's really, really important. And then the ones who already were paying interns, some of them have sort of raised the pay to keep up with inflation, which is, in the last few years, it has been a major concern for everyone. And then you can see a few other, I don't want to bore you too much, but this is just to show that change is possible. It has been achieved, and with sustained pressure, it can be achieved again. Upcoming important sort of events are the Global Interns Demonstration or the Global Interns Strike. That's going to happen on the 20th of February. This is one of the most important events for UN intern organizing during the year, and it's a way of showing that there are still people that are not being paid fairly, that cannot access these opportunities, sort of to remind external but also internal UN stakeholders that this is still an issue. It's an ongoing issue, and it will be until, probably forever, but until we get until we raise the standards around internships. And then this is more Geneva specific. Again, probably you're thinking of joining WHO. You will join WHO soon. You can engage with the FII locally, which is you can do it by sort of sharing your thoughts through this survey about priorities, about what you seek when your prospective interns, what do you seek out of this experience, and also to join our social events and our gatherings around Geneva. I'm gonna now move on to the sort of how you can get in touch, and you can find all the information about events across our channels. Which are okay. We also work with email, obviously. That's the newsletter goes out through email, stuff like that. But then when it comes to more informal gatherings, maybe you're interested, but you don't want to commit fully yet, you can come and say hi if you're in Geneva, or if you ever will be in Geneva. You can follow just the Instagram account and see where we meet, how often we meet, when we get a drink, when we go for a walk. All of that stuff is going to be there. So that's it. That's an overview of the FII and the internship experience in the UN. I thank you very much all for listening and for giving me the opportunity to speak. But also, I'm more than happy to answer any questions that you might have. I'll stick around and answer them in the chat, or I can also, I don't know if you want to open the floor now. If anyone else has anything to say on that, please go ahead. Thank you again for listening.
Thank you, Andrea. Thank you for this very informative presentation about what Fair Internship Initiative are doing. And to all the participants, if you have any questions, of course, please type in your questions under the Q&A boxes. Andrea's presentation reminds me that after completing my Erasmus Mundus Masters, I did an internship at International Renewable Energy Agency in Bonn, Germany. It is also a UN organization. However, my internship was paid. So what I can say from my experience is the payment, of course, made life easier. Although it was very interesting, somehow it's connected to this webinar today also. My internship was cut short due to COVID-19 pandemic lockdown. I could not do the full internship. I had to stop in the middle. But coming back to the paid part, is without the payment, I don't think I would have gone to Bonn, Germany. It would have been a bit too much. Going to a new city, getting for rent for a short time, it's of course expensive. So what you guys are doing at FII, it's truly commendable. And I'm glad to see that because of your advocacy, some United Nations organization, they started paying, and the ones that were paying, they increased to adjust with inflation. So thank you very much for your internship, and please stick around till the end. I think if there is any question, we'll take at the end. Now maybe I'll
Rajon, we have an interesting question that came on in the Q&A box, and this is directed towards Andrea. The question basically states that it's asking if we know which particular UN agency pays the interns the best out of all the UN internships that are available. Do you have any data from FII to share with the crowd in terms of a scoring of which agencies in the UN are paying better than others or something like this?
Yes, we do keep track of obviously the pay levels across agencies. I don't remember the numbers like exactly, so I don't wanna sort of speak without the data in front of me. But I know that in Geneva there's a pretty big divide between some agencies that pay really well, or like really well. They pay to a level that allows to cover all expenses and to live in a dignified way. And that off the top of my mind, I know that UNHCR is the one that pays the most. And then ILO, where I am. I mean, as I think, Rajon, you said that you wouldn't have been able to do your internship in Bonn if it wasn't for being paid. Absolutely the same for me. I'm only able to do this and to work on social justice and decent work and all these stuff because I have, to an extent, the protections that I'm fighting for when I'm in my work. So I think I'm really happy where I am because of that. And I believe then you have some, I don't know the numbers for WHO, but I know that they pay and they to a good extent, and then also IOM pays to a good extent, and I think WIPO. These are the ones off the top of my head. I know WTO also pays, and once again to a satisfactory extent. But then, for example, just to go to the other end of the spectrum, you have the UN Secretariat, UNEP, that don't pay, and that's like a huge issue. So it all happens on a scale, and some is better than nothing because again, it's all about sort of making that marginal difference for some people. But there's a lot of I would urge you to maybe reach out to current interns or former interns, like this panel is great for that. That can give you actually pinpoint you to the right information, because also there's other like details that are important, like do you get paid in what currency? Do you get paid on time? Do you have there's all things that can be then further obstacles that I encourage you to get informed. You can also get in touch with me, and I'm very, very happy to provide you with the actual exact data that's in some Excel spreadsheet that I can fish out of the drive. So yeah, thank you. That's a very important question. So thank you for that question.
Yeah, thank you very much. Thanks, Collins, for putting the relevant question just after Andrea's presentation. Maybe I would now move to Premikha. She was who Intern Board 23 co-president. She also will share her experiences with a PowerPoint presentation. And after that, we will move to more discussions with all the panelists. It will be very interesting. So I give the floor to Premikha. Thank you.
Thank you, Rajon. Can you hear me well? Great. And my slides are up, I hope. Thank you, everybody, for joining the panel today. I hope you have gained some insights from Wendy and Andrea. Today, I'll just be talking a little bit about the WHO Intern Board. I was the former co-president for the board, and in this panel, you will see a lot of members who are also the former members of the Intern Board. So just to quickly introduce the WHO Intern Board for you, our key objectives are firstly to curate like a vibrant WHO intern community by organizing a spectrum of activities, and that can be learning and development activities, social activities, welfare activities, and the main aim is really to bring people together, especially interns, so that we enjoy each other's company and we have some sort of social support. The second objective is to actually collaborate and facilitate knowledge transfer across other UN intern communities, and that also includes FII, people like Andrea and other folks. And there's also JPOs, junior professional officers, who are in a 2-year program within WHO. So we try to collaborate with them as well. And the last objective is we want to provide feedback to the WHO. We want to provide feedback about the internship program to the HR team, the human resource team, and the WHO Director General, so that we can actually enhance the internship program. So essentially, we kind of serve as a bridge between the WHO interns and the HR and DG. So if you look, this is actually a very quick breakdown of the intern network in WHO as of January this year. And as you can see, this is a breakdown by regions. So most of the interns are actually from the African region, the Southeast Asian region, and the Euro region. And you can see that we have probably need a lot more representation from the EMRO region, the Eastern Mediterranean region. So during the COVID-19 pandemic, because there was a lot of border controls and travel restrictions, so the internship program had to come to a halt. So essentially, the whole intern board had to be revived after 2 years. There were no interns for 2 years. The intern board also kind of just died down during that 2-year period. So it was only in 2023 where the board was successfully revived. And we wanted to just extend our gratitude to the steering committee members. So these are 5 members from the steering committee. They were also part of the initial batch of interns who came in 2023. So they kind of like tried to understand what was the formal structure of the intern board, put together resources and connections, and also conducted the first elections of the year so that we could elect the new intern board. And this is the former intern board. So as I mentioned earlier, I was the co-president, and along with me, there was also Alessandro as the co-president. Min was our secretary. Wendy, who spoke earlier about the internship process, was the communications coordinator. Collins was also our communications coordinator. We had Huang as our social coordinator, Miranda as our learning and development coordinator, Nikkei as the welfare coordinator, and Rabika as the FII, which is Fair Internship Initiative coordinator. So these are some of the roles that were in the intern board. And also these people whom you see here helped to put together this webinar and are here to share the experiences here with you today. So I just wanted to give you a very quick introduction to some of the initiatives we organized in 2023. So firstly, there were some growth workshops, and these workshops were meant to enhance our personal and professional development. So if you look at the picture on the top left, you can see that there was a workshop on innovative facilitation tools where interns and supervisors were exposed to facilitation techniques that they could use in their day-to-day work. Right below, you can see that we had a WHO 75 campaign workshop. And in this workshop, we kind of aim to infuse a youthful voice into the WHO's Health for All campaign so that we could increase the outreach of these campaigns to youth. And if you look on the right side of the slide, you can see a picture with 3 whiteboards. So we also conducted like a mini workshop to consolidate feedback on the WHO internship program. And all of this post-it notes that you see on the board is like different feedback that was given by different interns. And we kind of compiled this into a report that was presented eventually to the HR team and the Director General. And during 2023, we also helped to kickstart the collaboration with the junior professional officers, where both the JPOs and interns can be given the opportunity to share more about their work and identify areas where we can potentially work together. So this was an opportunity for interns to learn more about other departments, and also for us to like think about our career beyond just the internship. So other initiatives include expert engagement. So on the left, you can see that we actually had this is a group picture with WHO Director General, Dr. Tedros. We organized a fireside chat with DG to gain his insights on developing a successful public health career. And this was a very personable talk because DG was sharing a lot of his personal stories, and it was very easy to connect with him. And at this meeting, we also presented the top feedback points that we collated on the internship program, which I shared on the previous slide. And we managed to successfully raise the intern lunch stipend by 33% in this meeting with DG. And on the right, you can see that we also organized a meeting with WHO's chief scientist, Dr. Jeremy Farrar. It's a little small, but he's standing on the second row at the back. And he was sharing a little bit more about his career in public health, and it was a very candid, down-to-earth conversation about his passion for public health and how he had multiple career tracks at different points in his life. So beyond just engaging with internal folks, we also had some events where we represented WHO Intern Board externally. So firstly, at the top, you can see that we represented the IB in the World Hearing Forum last year, where I participated as a youth panelist. And the panel was just focused on understanding the importance of and the barriers to changing people's societal perceptions related to hearing loss. Right below, on the bottom left, you can see that we also represented the intern board at the International Interns Day, which was organized by the Fair Internship Initiative. And because of this kind of relationship and partnerships we have with other UN bodies, we also organized complimentary tours of the UN headquarters in Geneva for WHO interns. So you can see a group of us taking photos with the flags at the headquarters on the right of the slide. So apart from just all this events, we also would like to have a good life at WHO. So the intern life during office hours, we usually have our weekly board meetings, and these board meetings have like an open door policy where any intern can walk in to listen, share their thoughts, etc. We also have weekly intern lunches. We had a Halloween celebration last year in the canteen, the office, like so-called the cafeteria area. And we created this board where we stuck post-it notes of the scariest intern experiences, and we got some of the WHO staff to read our post-it notes. They were pretty amazed at our stories that we had to share. And we also managed to successfully revive the gym access for all WHO interns. But we don't only have fun during office hours, so we try to have fun after office hours too, and this after 5 p.m. hopefully for those with a good work-life balance. So we go out together to have cheese fondue. We do farewell gatherings, whether it's at a karaoke area or just at a board games cafe. We also explore the Geneva Lake. It's very beautiful for those who have not been to Geneva. So last year we were there during Christmas as well. So there was also a Christmas market, Christmas celebrations that we had fun. And apart from all these activities, the board would not, what brings the board together, or what puts it together is the backbone. And the backbone of it is really just having good communications and other sorts of infrastructure that can support that. So we started like a WHO intern database on Airtable, where interns can voluntarily provide your information, and they could be a part of our community. And by being in our database, we could actually send out communications and publicity materials for our events. And also, this database is directly linked to our website. So intern profiles can also be directly featured on our website as long as they get registered to the database. And on the right, you can see that we also have a link tree with details of all our social media platforms, which includes our website, Instagram account, calendar of events, etc. And other initiatives in 2023 was that we actually created a new intern board logo that was compliant to the WHO guidelines, so that we could actually use it in official communication materials. We also created transparent election procedures that would give most, if not all, interns an opportunity to serve in the intern board. And we also drafted like a statutes document, which we wanted to hand over to future communities so that they could get the intern board up and running. So I know that many of you who have joined the panel today are probably pretty excited to do a WHO internship. And if you do get an offer and you start an internship, we would be very thrilled to have you on board as an intern board member. And now we're gonna move into the panel discussion, and feel free to fire any questions you may have about the internship program or the intern board in general. Thank you.
Thank you, Premikha. I hope that some of our participants from today's event will end up as WHO interns soon and will be in the next board. That's the hope we have. And now, as
Yeah, I
Premikha
hope so
mentioned,
too. Thanks, Rajon. Go ahead.
yeah, as Premikha mentioned, we will go to panel discussion. But before we go and start discussing and answering questions, some of you have presented, and some of you are yet to be introduced to the participants. So maybe before we go to the discussion, I would maybe ask all the people that have not presented yet to introduce themselves shortly. Maybe I can start with Min. If I can start with you, if you can introduce yourself and spin the bottle to someone else.
Okay, can you guys hear me clearly?
Yeah.
Yeah, okay. So
Yeah.
hi, everybody. Hi, everybody. Thank you so much for participating in the webinar today. So my name is Min. I'm Vietnamese. I'm currently in Hanoi. And I was working at WHO within the Chief Scientist and Science Division. And I work for the Research for Health Department within their Emerging Technologies, Prioritization and Support Unit. And my duty at the time was to support the team to help implementing the framework for responsible use of life science. So we work with the BioRICS working group to prevent things like bioweapons. And we implement the framework in the regional and national levels. And I also help them and support them in the, organize many webinars as well as the workshop in science, for example, genomics or other biotechnology related things. So I would really like to address some questions regarding to science later on. So I would pass this to my fellow colleague, maybe Collins. Can you keeping up with the introduction?
Sure, yeah. Hi, everyone. My name is Collins. I'm from Malaysia, and I was interning at the WHO for 6 months. I was with PMNCH, which is the Partnership for Newborn, Child, and Maternal Health. And I worked together with Nikkei and also Prince on the Global Forum for Adolescents, which was basically the largest ever global gathering of young people on this sort of virtual hybrid stage. It was a 2-day event in October. We had about 8,000 or 9,000 participants in this 2-day event, sort of gearing up commitments and also sort of pledges to advancing adolescent health across the globe. And actually, coming out of that event, there were a lot of country commitments, which Nikkei knows a lot about, towards advancing adolescent health. It's really nice to be here, and I'm here to answer any questions that you may have in terms of going to an internship with the WHO. You know, for me, going into an internship at the UN agency was something that I would never have thought that I would do it. And it's something that was definitely not possible if the internship was unpaid. There was no way that I could afford to go and do an unpaid internship. And so when I found out that the internships at WHO were paid, I was very happy and I went for it. We'll speak more about this later. Maybe I can pass it over to Nikkei to take over. Thanks.
Thanks, Collins. Hi, everyone. So my name is Nikkei Salami. I'm from Nigeria. So I was interning with the Partnership for Maternal, Neonatal, and Child Health, along with Collins and Prince. And the internship was very new for me because I come from a medical background. Quite a few of us do, but you know, it's not mandatory. There's so many different departments that you can apply to. And so I was working on getting governments, UN missions to commit to adolescent health and to work on the first ever Global Forum for Adolescents as well. So yeah, it was a great experience actually. But I'm looking forward to answering any questions. If you have any concerns, anything you'd like to clarify, don't be afraid to shoot a question. So yeah. Passing it on to Miranda.
Hello, everyone. It's a great pleasure to me to be here and share my experience as well. So my name is Miranda. As you mentioned already, I'm from country of Georgia. And my experience in WHO internship, including at Nutrition and Food Safety Department. Mainly, we work in the food safety issues in different countries. We're organizing country profiles and different assessment reports. And I had a background in public health, so I'm doing at the same time PhD in public health. It was my last semester, and it was a little bit challenge for me to manage like both things, internship in Geneva, and at the same time, it was my last semester in Georgia. But hopefully I done already. I got my thesis defense when I back after this internship in my country. Yeah, it's about myself. So if you have any questions, welcome to answer. And thank you. I forget to mention, I think Alessandro, he was at the same department as me in nutrition and food safety, probably can continue.
Yeah, okay, I can jump in. Hello, everyone, and thank you, Miranda. I'm Alessandro Catalini. I'm a public health specialist, and during my internship, actually, I was a public health president. I graduated recently, and I interned at a unit that was called Monitoring Nutritional Status and Food Safety Events. That was part of the Nutrition and Food Safety Department. And my role inside the unit was to help in monitoring the nutritional status of children all around the world. And so monitoring malnutrition essentially, and I was supposed to review data coming from countries to produce national estimates. And it was a nice experience because I had the opportunity also to collaborate with UNICEF and the World Bank in doing this. And what else? I come from Italy. So I'm Italian, and we can move on to the next one. I don't know who has to speak. So Huang, maybe. Go ahead, Huang, please.
Hi, everyone. My name is Huang, and I'm from Nepal. And I'm a traditional Tibetan doctor. And currently, I'm interning at the Immunization, Vaccine, and Biological Department of WHO. I'm working on the data governance guideline for Immunization Agenda 2030. So basically, it's a global vision and strategy endorsed by the World Health Assembly to strengthen immunization efforts over the next decades. So the Immunization and Vaccine and Biological Department of World Health Organization is responsible for preventing disease through vaccines. Their mission is to promote the impact of vaccines worldwide by leading global efforts, conducting research, and providing guidance. So they have 5 functional units, which are Agenda, Policy, and Strategy, that leads Policy and Strategy Development and Immunization Analysis and Insights Unit, which is my unit, and they manage global immunization data analytics and surveillance. And then there is Product and Delivery Research, which focus on research for new vaccines, technologies, and innovations. And then there is an Essential Program on Immunization, EPI, which aims to improve coverage and equity in immunization. And lastly, there is Vaccine Alliance and Partnership, which manage partnership with organizations like Gavi, CDC, and BMJF. So if anyone is interested to apply for internship at the IBP, I'm happy to provide some information. So feel free to reach out. Thank you.
Thank you, Sevan. Who will be next? If we have someone missing, or maybe
I think that's everyone.
I'll go to Premikha. Maybe I think during her presentation, I think she did not introduce herself in detail like all her colleagues, but maybe now is the time.
Thanks, Rajon. No, I just wanted to share a little bit more about which department I was from and where I was from. So, hi everyone, I'm Dr. Premikha. I'm a physician by training, specializing in the field of public health. I'm from Singapore, and I was interning at the WHO Innovation Hub, which is a unit in the Department of Digital Health and Innovation. Yeah, so mine was my internship was about 4 months long, and I've worked on a range of things, including developing the long-term strategy for the Innovation Hub and worked on a couple of WHO publications. I also helped to plan some segments of an international forum and moderated a couple of panel sessions there. I'm happy to take any questions related to the Innovation Hub or just the WHO experience as a whole. Thank you.
Thank you, Premikha. I think all of us have introduced ourselves, but it was interesting to observe that during your presentation, all of you mentioned which department, which division you were a part of. It's good to know that WHO, it has different divisions, and under those divisions there are different departments, and within the different departments there are different units. So you guys cover a lot of units within yourself. It is nice to see that. And moving to the panel discussion. So just for the participants to know that the topics that we are going to cover is the experiences and challenges faced by our panelists during their internship, and the role and impact of volunteering on the intern board, and also some career pathways and different opportunities after they have completed their internships. And in retrospect, what are their reflections of the program's evaluation, and especially after, especially post-pandemic. So maybe I will during the panel discussion, we'll also take questions from the audience. I see some questions already on the question and answer box, but just to get the ball rolling, maybe I will ask one question and start the session. Is if anybody would like to answer this one, if someone can tell me what was your experience. I'm taking this question from the presentation earlier, that during the pandemic for 2 years there was no internship program, and then you had to restart the intern board. So how was the experience of restarting the intern board? Especially, I wanted to know the challenges, because if there were no intern for 2 years, there was of course a gap between the last batch of interns and you coming in. What was the challenges, and how did you overcome these challenges in restarting the intern board? If I can start with Collins, who has his hands raised. Collins.
Yeah, thanks, Rajon. That's a very important question. I was one of maybe the first 10 interns who came to the UN, to WHO HQ post-pandemic. And when I arrived there, there was a few other interns who had already started sort of like a network and some kind of activities to keep us going. So I didn't feel alone. I felt very welcome. They were very welcoming to everyone. And I guess people were just kind of happy to see more interns coming in. It was like a new thing and starting to get the ball rolling. For us, as the intern community, it was really difficult because when I came in and I heard about this intern board, and I know it exists, but I was trying to figure out, where the board is, or how do I get in contact with people who know some information about this internship board. And I was asking around, and because it's been so long, it was like almost 2 years that there were no interns. Some of the information was not really easily accessible. And it was a very long process of trying to find out who was the previous board who had exited. And it took months. It took me like 3 months to find the contact and to get into our sort of drive. And then once we got into the drive, some of the interns really gladly stepped up. All of this is voluntary, so we don't get any benefits out of doing this activities with the intern board. So some of the interns, they graciously volunteered to step up and lead the steering committee. because those who lead the steering committee, they are not able to participate in the elections. And so they kind of have just a very specific role of setting up and getting the board elected. And the group of them that you saw earlier from Premikha's presentation volunteered to step up and take time out of their own personal schedules to organize it and have an election, which I believe was very transparent, very fair. And it gave everyone the opportunity to sort of step up if they wanted to and take a role in this board. And I think the challenges were basically a lack of continuity, because I mean, it's understandable that we don't have, like, the previous intern board members were off for 2 years, and then suddenly we're contacting them and asking them about this intern board. It's been 2 years. And so just trying to get all of that back and trying to recover all of the past programs that have been happening and the initiatives. We didn't want to lose any of it, so we tried to bring back as many of them as we could. But then it's more of like a bandwidth issue, because we need to slowly recover one by one. So even, for example, like I took on the role of comms coordinator, so I started to recover first the Instagram, and then the website, and one by one. And then slowly sort of build as much as we could. From me, that was the challenge that we faced, mainly just having that continuity. And one of the things that I did with Alessandro before leaving as well was to come up with sort of a plan, a framework for contingency planning, succession planning, so that there's some kind of a backup that prevents like this loss of information when there's a change from one board to another. I think that's very important in such a situation where you have a community of people who are coming in and leaving very frequently, because the maximum that an intern can stay in Geneva in this internship program is 6 months, some of them even less. And so it's just challenging, you know, when you have a board that's going to change every 6 months or sometimes even less, or if some people move in and out very frequently. It's really tough, and just having that continuity and having the documentation of things to hand over to the next person is definitely a challenge. Maybe some of my colleagues can also comment on this, but this was from my experience. Yeah.
Thank you, Collins. There are so many international intergovernmental organizations. But I don't think all of them, they have such a structure of an intern board, a platform for interns where they can come together like you guys have done in WHO. So I remember when I was an intern in IRENA, there was no such thing, not such a structure, an intern board. If, for example, after seeing this webinar, or maybe from word of mouth from someone, some participants here, if someone wants to do something similar, organize themselves in a very like some structure like yours, intern board, what would be your advice? If what should they do in their organization to have a similar structure like you, or maybe restarting their old structure if there was one before? So if anybody wants to answer that one. Yeah, Alessandro, yeah.
Yeah, I can go with this one. Well, actually, adding something to what Colin said, it was very hard to restart the WHO intern board, but I noticed that after that we did the first, let's say, workshops, the first meetings with people inside WHO, things came like quite naturally. It means that departments or people from departments or other units or internal stakeholders of WHO started contacting us because they wanted to collaborate with us. So if someone wants to establish an organization like this somewhere else, I would suggest that all the efforts to be done are at first, are in the first phase, and then you'll be rewarded for what you did. And for sure, the first thing to do, I think, is to establish a steering committee, as we did. It was a very good idea to guarantee a very smooth and also let's say equity process to establish a board. And then you need a lot of motivation, of course, because at the beginning things can be very frustrating because you have to retrieve a lot of, maybe we had to retrieve a lot of stuff, a lot of things that colleagues did this very well. But at the very beginning can be quite frustrating, but at the end you're rewarded for the work that you did. So yeah, I think that a steering committee, it can be the right way to start.
Thank you, Alessandro.
I don't know if someone wants to add something on that.
Yeah, I think Andrea wants to add to your point. Please go ahead, Andrea. Yeah.
Thank you so much. Yes, no, I completely agree with both Alessandro and Collins. I think it is a challenge to kind of keep it together. That is really, you know, it's relatively easy to find sort of people that are interested in joining and kind of like enhancing each other's experiences. But you know, we are in contact with a lot of intern boards and a lot of people across UN agencies at the FII. So if they can offer a little bit of that perspective, I think something that people find very, very effective is to have internal support by either the staff union. Most organizations have a staff union, so they usually are interested in helping the interns kind of organizing, doing a little bit of capacity building, helping it set up, and also eventually HR or other institutional contact points within the organization to make sure that that's, you know, they recognize the intern board, they recognize the organization, and they can somehow help maintain that kind of continuity and institutionalizing the intern board. It is, I mean, I would say any intern organization, whether like no matter how formal, is great and can really enhance your experience as an intern. But then when it comes to, I mean, all the wonderful things you did at WHO, I'm, by the way, really, really impressed with the work that you've been able to do. I think that stuff really is, you know, can be achieved once you have, you know, that institutional structure. So completely agree with what said before, and kind of you know, takes a lot of motivation, but it can be done. It can be done.
Thank you, Andrea. I think Wendy wants to add some points to this one also.
Yeah, thank you. Also to want to add on the fact that motivation is very important is I totally agree with that. I think that before you talk about like having a structure, documents and that kind of stuff, I think it's very, very important that you have this group of people who have the initiative and the strong motivation to really want to have this work. I think this was a very important thing that helped our intern board work. And I would like to actually take this opportunity to have a big shout out to all of my fellow intern board members that I think we were a very motivated and very great group. Like we really worked together to make a lot of amazing things happen. And yeah, that's some of my comments of restarting Intern Board. And also another thing to say is that I know that some other UN agencies interns, they're also starting their intern boards. But still, I think that our intern board is like currently like one of the the best intern boards so far. Like we really like achieved a lot, and for me it was a very amazing experience.
It's nice to hear about this nice experience that you have gathered. Nice. Yeah, maybe a continuation of the question of this next question would be, when do prospective interns apply? When should they apply? Maybe this question could be for Premikha. Is it on a rolling basis all year around, or are there a specific window, some certain months when internships open? Like if I am a prospective intern, when should I start looking into that online portal? So if you can give some more information on this.
Thanks, Yulia. Thanks, Rajon. I realized that Yulia has also posted a similar question on when job openings are actually posted. So the thing is, I think WHO internship program the openings are very unpredictable, unfortunately. They don't have like on the 1st of February, I will release X number of openings. And on the 1st of April, I'll release another set of openings. There's no such thing. Because even though the internship program is sort of centralized, each department within WHO has autonomy to decide when they want to have an intern and when they would like to put the application up on the system. So it could happen all year round. And I think if looking at the eligibility criteria of interns, where you need to be post-graduation at least 6 months, like within 6 months, right? So I think to be safe, you should start applying 6 months before you graduate, because the whole process is very protracted. So for me personally, I started looking at the portal about 5 months before I graduated. And I didn't apply immediately. It was more like I was scouting for roles that I thought I would like. And I applied for those that I think I would like. So I was applying to different positions within a month. And then after that, I stopped. I was like, okay, because any later than this, I won't be able to take the internship because of my own personal career timeline. So I was waiting to hear from them. And WHO is pretty slow. It takes like a few months for you to even hear back from them sometimes. So when you hear back from them, it could just be an interview. And once the interview is done, it takes a bit more time before the team decides to offer you something preliminarily. And once you get the preliminary offer, it takes even more time to onboard you and give you the official letter of offer. So I would advise to start 6 months before you graduate so that you have at least 1 whole year of being eligible for the program and being like higher chance of getting accepted as well. Yep.
Thank you. I think Min wants to add to this point. You are muted, Min.
To add up into Prem's answer, I was checking my application site, and I was applying for 25 positions within a year in order to land at my position at the science division. And I also want to strongly encourage candidates in science major or biotechnology. As one of the participants in our webinar was in clinical laboratory science degree. And I think there's plenty of opportunities for us, the people who having the background not in the public health domain or in other like medical doctor degree. So we have plenty of positions, for example, in the science division, or either doing statistics in the epidemiology department. So you just need to find the most suitable criteria and requirements of the position. And there would be plenty of hope. Don't worry. Okay.
Thank you, Ben. I think Adhinika wants to add something also here.
Yes, thanks. I also wanted to add to what Premikha said. So it's important to note as well that the eligibility is 6 months after graduation, but that's at the time of application. So actually, if even if you're 5, 4, 6 months post-graduation, you can still apply. And then it just has to be at the time of the application. So, even if the onboarding is slow, the process is slow, as far as you're willing to wait, you're still eligible as far as your application was made within 6 months of graduation. So I just wanted to clarify that.
That's important information. So it's not that you have to start within the 6 months of graduation, but your application has to be successfully made within the 6 months of your graduation. Okay, Collins, please go ahead.
Yeah, so I just wanted to add a little bit also. The Stellis platform is quite handy in this case because it allows you to create a profile. So you go into Stellis, you create a profile, complete your profile, like upload as many things as you can in there, your picture, your certificates, whatever they allow you to upload it there. It also allows you to have alerts. So if you selected that, okay, I'm interested in internships, specifically what areas, whenever there is a position that is opened within the Stellis system, which the entire WHO sort of runs off, you will immediately get an email to say, alert, this position has been opened, and then it'll give you a link which you can go in and directly apply. So this is something that I found really useful, because when I was looking at internships at WHO, I had this alert and I gotten like 4 or 5 alerts to 4 or 5 different internships that I was interested in. And so I did put in about 5 applications before I was selected for this particular one. So that's maybe a tip if you're interested in doing an internship. When you're in your course, while you're doing your master's program, just go in and create the profile and just keep a lookout and see what pops up. Because the reason why the process takes so long is because there are sometimes hundreds and hundreds of people who are just applying for the same internship. So it's really competitive, and the HR department has to go through all of them to be fair. So it takes a long time for them to go through everything and shortlist candidates. It's a very long process. Yeah, thanks.
Premikha, please, you.
Yeah, no, I just wanted to maybe zoom out a little and put things in perspective. I know for some people, like, knowing how long this whole process is, waiting for up to 6 months from your application time can be very daunting and a lot of uncertainty. And I feel like along the way, it's good to, I think it's important more than being good. It's important to keep your options open. So not just apply to the WHO internship program, but also apply to other opportunities that is suitable for you and your profile. And whichever opportunity comes to you, I think it would be good to consider taking it out instead of waiting for something for a very long time. Yeah, so I just wanted to put that in perspective. Thanks.
Thank you, Premikha. It's important feedback or suggestion. Yes, we would like to do an internship at WHO, but of course, don't only focus here. Keep applying to other places, other opportunities, other doors can open anytime. So yeah, that's Ademika, please.
Thank you. So I just wanted to address, there's a handful of questions that were addressed to me still about the criteria post-graduation. Like I said, I'm from a medical background, so I'm from Nigeria, and here we have a 1-year internship that we do after graduation. So this is to address Abisola's question. So I actually applied within the last month of med school when I was writing my finals, and then I had to wait and delay my housemanship, which is what we call our internship program. And then I went for the WHO program, and it's a bit of a trade-off. Honestly, you just have to decide, if you really want to pursue something else, and you kind of have to make the decision whether you want to take that chance. But like Premikha said, it's important to strongly weigh your options, instead of just waiting for something that might never come. You also need to consider, like, hey, maybe I should actually consider going for this, maybe I should wait. You should also apply wide. This webinar is about WHO, but there's so many organizations that can offer a similar experience. There's UNICEF, there's ILO, there's UNHCR, there's so many of them. You just have to do your research, apply to as many. Like Min said, she applied to 25. So, I've actually had a couple of messages. People said, they applied to 3 and they haven't heard back. And, these things are so competitive that, like, you just need to apply. And don't also forget about, like, other opportunities. Like, don't say, hey, no, I must go here. Like, just keep your options open and something could happen. Yeah.
Thank you, Ademika. Wendy, if you want to also add something to this.
Yeah, sure. Thank you. Also for about adding to Nikkei's point is that I also agree that don't just to keep your options open and just don't focus on this particular position or department. For me, I also applied to several ones, and then until I got the opportunity at Enhanced Wellbeing under the Health Promotion Department, which is not really relevant to my academic background, but it was also a good opportunity. A learning experience to me as well. And then in my case, at the beginning, I did rely all of my hopes on the internship at WHO. At the beginning, I was I just wanted to go to WHO like so much, and then for me, I got one interview and then I had to wait for like a month to hear back that I was rejected. And then that month was really like, I was pretty like stressed and anxious because at that time I put all of my hopes on that one. And when it turned out it didn't work, I was like, really like in like not like a good mood. But later on, I realized that I should not like put everything on this. Like you still need to move on, and there's so many like other opportunities out there. And then it was so I started to like work for a full-time job in April, and then it was at the end of April my team contacted me and then wanted to interview me, and then that was like a very unexpected. So I guess is like don't from my experience, I think is that do apply as much as you can, but don't feel that you are not good enough if you don't receive anything back. Just try to keep your options open, and then something else might happen later on.
True. Thanks, Wendy. I think I can copy paste the advice of Warren Buffett from investment. Like, don't put all your eggs in one basket. I think very similar to here. Not just don't only apply to only a few internships at WHO, but a lot of internships in WHO and also outside of WHO. You never know where your destiny can take you. So you could end up in a very amazing, nice place. So yeah, so maybe let's shift the timeline. We have been talking about application timeline, how to apply, what to keep in mind. Maybe I will jump to the future. Maybe I'll go to, because one of the questions is regarding how this internship has shaped your career trajectory. I see Alessandro wanted to answer this one. So maybe after Alessandro, others can also jump in. Like, how did this internship help you in your career? Especially, I see Mariam Samaila. I think he or she is starting internship in February. So please, Alessandro, yeah.
Yes, thank you, Rajon. Yes, about how the internship shaped my career. In my personal opinion, when I started my internship, actually, everybody at my unit was telling me, you will see after your internship, you won't have any problem like staying in the UN system or having a job around the UN system or in this kind of workspace, let's say. And actually I can tell that this is what happened. I mean, I received some interesting offers after my internship, and so the internship at WHO can shape your career. This is true. I mean, it's not a rule because but I heard from other colleagues also that they received interesting let's say proposals, and so an internship at WHO means a lot. Okay, this is a good thing to put on your CV, of course. And about the advice for incoming interns, well, first, participate to the WHO Intern Board activities, because this is a very good way to get to know closer your colleagues, to have opportunities to know people inside the WHO. And if you have the opportunity also to be a member of the WHO Intern Board, to apply for the WHO Intern Board, please do it, because you will have a lot of opportunities of improving your skills of public speaking, of improving your skills of leadership. And this is the way to live your WHO internship at its most. Then another thing, of course, it depends, of course, on the on how your internship is shaped by your supervisor, how much your supervisor requests you to work, of course, but enjoy also life in Geneva. Enjoy going out with the other interns. Don't stay always in your department working because you want to show that you are able to handle with a lot of work, because this is okay, but overworking is very bad, because there are a lot of things to explore, a lot of opportunities to catch that you will find outside WHO also, that you don't want to miss them. So this is another suggestion that I would like to share with you. And maybe I pass the word, I pass the floor to someone else if they want to add something on that.
We can go to Premikha. Yeah.
Yeah, thanks, Alessandro. So, I mean, I definitely do agree with you that you do get offers, but I just wanted to clarify with folks here that a WHO internship does not necessarily translate to a full-time job in the WHO, because some interns do come in with that expectation, hoping that if I do very well during my internship, if I work like 7 days a week, stay in office, so like, I don't know, 8 p.m. or 9 p.m. every day, I would get a job. In fact, the chances of you securing a WHO job after an internship is almost zero. And it would be stated in your internship contract that you are not guaranteed a job. So I mean, there are definitely good and bad things to that, but I think on the bright side, it removes that competitive element among interns. And I feel like it gets you to learn from each other more openly. And like what Alessandro said, I think if you just get out of office by 5:30 p.m. every day, you make sure that you interact with people from other organizations within Geneva and in the international context, and that itself would open opportunities for you in other industries or organizations. Yeah, that's it. Okay, maybe you wanna share more?
Yeah, Premikha took the words right out of my mouth, because I just wanted to clarify that a lot of interns only found this out when they were in. Even some of us on the call literally found out. I remember when I was speaking to someone and he was like, "What, really?" And I was like, "Yeah, like there's no, like, in fact, it's like Premikha said, the chances are, in fact, just take it as zero. It's not zero, nothing is zero, but I think it's best to take it as zero, because it's just not what they were aiming to achieve by opening the internship program up." So I also just wanted to add that, but I think Premikha's covered it. So
Yeah, also to add on to that, since Andrea is here as well from FII, so one of the interesting things that you could do while you're interning in Geneva is also go and hang out with the FII group. They're quite active, the Geneva unit, and I believe they meet bi-weekly, once in 2 weeks, and that's something, a fun activity. You can go meet interns from other organizations and see what they're doing, and yeah, it's a very good social thing as well.
Yeah, just to kind of give a little bit of information on the meeting and stuff. We do both kind of more formal events, like when we discuss advocacy and organizational questions, but obviously we have social events as well, which is the best part, because then it's kind of like it mixes both the idea of, having fun and meeting people, as many people say on this panel. It is essential to having a good internship experience that you balance those two things out. And then you meet people. Also, you have the kind of unique opportunity of having people come from countries you've never even heard of. You don't, like learning so much about people's, backgrounds and cultures and the way they see the world. It's so enriching. And then obviously you're like, oh, hold on, like, how is your relationship with your supervisor? Like, you kind of like get a sense of how your internship experience fits in the general internship experience and how to maybe advocate for yourself. We talked about like jobs and potentially staying on with the organization. You want to know what's out there. You want to know how people are navigating that, and doing it through the FII or other ways of connecting with interns is, I think, very fulfilling and very exciting. So definitely welcome everyone to join all the events, and looking forward to meet a lot of you.
Yeah, thank you, Andrea. Maybe I take this discussion towards the direction of Geneva, because I think Premikha showed that you guys had a lot of fun eating cheese fondue and visiting the Geneva Lake. Maybe, I don't know, one such question was also there. I think it was answered, but you can of course answer again. Is Geneva the only place to have WHO internships, or I don't know, are there other locations, or is just a fixed place that you only go to Geneva for such an internship? Min?
So I believe that there's regional internship opportunities as well, because WHO has regional office in all the continents, as well as I don't know for sure how about the national office, Maybe they also publish regularly the internship positions, but for sure the regional ones are regularly published. And I also receive some questions from colleagues and candidates from other regional office. And you can feel free to go up to the website and check regularly. For me, I do it daily when I was applying for the job. So for you to not lose the opportunity.
It's nice to know that there are regional opportunities. Maybe, I don't know, one of our speakers is from Nigeria. I said there could be an opportunity in Nigeria or maybe a nearby country. So instead of just focusing on an opportunity in Geneva, might be really nice to look into some opportunity in your own region. You might, I don't know, I'm telling this outside perspective, but might be easier to get something regional also. Maybe the one in Geneva would be highly competitive. And anybody wants to add anything else? I think Min's answer was pretty solid. Yeah.
Yeah, I can add a little bit also. I think at the time that when I applied for the internship program, they were just restarting. So we are kind of like the first batch. So I believe that the internships were only at HQ. So they started out like snow to roll it out. So they rolled out with HQ first. I don't know now what is the situation, whether the regional offices or country offices are taking in interns. But I believe that that is the process. Like sooner or later, it will expand further, from my understanding. Yeah.
So
Yeah. Oh, sorry, Min, go ahead.
So I just want to add that at least I know that in European regions, the office in Copenhagen was opening right after us to hire the intern. Yeah.
Yeah. Oh no, I just wanted to quickly add that when I was applying, that I came across some regional office internships and even a couple of country office internship openings, but I did not apply to a lot of them because they were either in a region that was not relevant to me or a country that's not relevant. So I think just be on the lookout. From what I know, the HQ probably has there's much more options in terms of internships in the HQ, but there are also some ad hoc options from the regional and country offices.
That's yeah, thank you. That's I think many people might have similar questions like, okay, are there other places outside of Geneva? And that's nice to know there are more opportunities globally in your own region. And yeah, I think we are almost towards the end of this very interesting webinar. I think a lot of you, the panelists, you've tried to answer the questions directly in reply of the Q&A. And I think one common question in such a webinar is from participants is, do I get the slide? This is very interesting. So I think Collins will try to check with the speakers and get back to the participants via email whether they can get the PDF version of the presentations. That would be really nice. I don't know if at the end, if any of our panelists would want to add something before we do a wrap up. I don't know. I'll start with just putting Collins on the spot, maybe, or Adinika. Yeah, thanks for raising your hands here.
Yeah, it's just there was one last question. She said, how do you keep your energy and positivity in the midst of such slim chances? So I just wanted to say that, right now it's all colorful and, bright positivity, but it wasn't always like this. I actually had a period when I was, in between the interview and getting my offer. It was such a dark time because, there was so much uncertainty, so much waiting. And so it can be difficult to be positive, but you just have to, immerse yourself in things that make you happy. Still don't pause your life because you're waiting for an offer. Still do things that you love, and if you get it, great. And if you don't, you pick yourself up and you try, keep applying. So I just wanted to end on that note. So yeah, thanks everyone for being here.
Yeah, I think that's a very important ending note. Knock on all doors. Some will open, some might not. But whichever opens, go through it, and you will have experience there. That's the way forward, I think. Yeah, Collins.
Yeah, I would just like to say that the WHO internship experience for me was a really fun one. I really enjoyed working in Geneva, getting to run around the HQ, and then also getting the chance to go to the Palais and to see other organizations and what they're doing. I would encourage everyone to apply for an internship with the WHO. You can only do it once in your life, so go for it. I mean, with the criteria of like, you know, within your graduation time or when you're still studying. And there's this misconception that the WHO is like this health agency, so that everyone who goes to intern there has like a health background or something. That's not the case. When I was leaving, they also had interns who were doing linguistics, because actually the WHO, they have their own sort of internal translators as well. So normally, if you're a student who is studying interpretation or translation, you would apply to the UN, because that's where the secretariat is, and that's where they have like the interpreter booths and stuff like that. But within the WHO, they also have their own internal interpreters and translators. And I was quite surprised to see someone interning at the WHO and from a language background. So, and there's also finance, there's also comms, there's also lots of other things that's needed in any organization, right? So even if you're not a medical background, I highly recommend that if you try and just apply for it, if you fit the criteria, and try to get an experience. One of the things that's very important is that the internship is paid. And I'm one of those kind of people who really strongly advocates for having internships being paid. And I personally turn down internships that are unpaid just because I can't afford it, and I don't think it's a fair thing. And I strongly encourage people to go for paid internships and rather just ignore those that are unpaid. I don't think it's a very sustainable system. Thank you very much for having me today. And it's really good to see all of you. It's been a while. And yeah, I'll hand the floor to someone else now. Thanks.
Any of the panelists wants to have some closing remarks? Maybe I'll put, I don't know, Miranda, if you want to say something. I think you.
Yeah, it was so nice to join today. I just pay your attention, like in the beginning of the application process, when you see the call of this position, there is always the deliverables, so what you have to do in your internship and the learning outcomes. And when you start to write your cover letter, always beginning and try to find your match with these learning outcomes, because your potential supervisors always checking this, how you can fit to these learning outcomes, if it should be useful for you and for them as well. And that's this one of the trick, or how should I say that, pay attention to this specific position and what not only the general eligibility criteria, but also the specific ones which it's connect the objective of this position and the learning outcomes, because the main idea of this internship is to give us some kind of skills and competencies and responsibilities, to develop your not only personality, but also your skills and knowledge. So this is my final words, and keep going, always apply and apply and apply all the time, as much as you can, to achieve your goals, I mean. And yeah, you get your point, I'm sure. Good luck.
Thank you, Miranda. Thanks. I think it was very, very motivating at the end. So a fitting closing remark, I would say. So yeah, thanks to all the panelists. I think it was wonderful to have you here and share and listen what you did, both in terms of your internship and also, what you did to revive the intern board and what you did in the intern board. Thanks for sharing all the information. Especially thanks to Andrea. The things that you guys have been doing for paid internship, it means a lot for a lot of people who especially come from underdeveloped region. payment, internship payment would make their internship much easier and give them the opportunity that otherwise they would not have got. So thanks to FII for this wonderful initiative, and thanks to all of you, Collins, Mill, Ademika, Miranda, and Wendy, and Huang. And yeah, until next time, have a nice day, evening, good night, depending on your location. So yeah, and thanks to all the attendees. Same to you. Have a nice day, evening, night. Yeah, bye bye.
Thank you very much. Thank you so much.
Bye, everyone.
Thanks, everyone.
Bye,
Good luck
good
on your
luck.
applications.
Evening, morning, afternoon. See you guys.